6 simple steps, our definitive guide to beating low back pain in 2023. So a very quick snapshot. Low back pain is the leading cause of disability in over 160 countries right now, and more than 84% of the population will experience it at some point during their lives. And less than 5% of back pain cases are actually due to serious medical issues. Yet, chronic low back pain affects roughly 38% of the population. So something doesn't add up on that end. We need to do a better job at managing low back pain. And this video is hopefully going to outline the 6-step process of the gold standard of back pain care based on the clinical care standard guidelines that were produced by the Australian Commission on Quality in Healthcare in 2022. So what is low back pain actually costing Australians right now? Well, firstly, it's costing us our health, because it affects 4 million Australians, most likely between the ages of 35 and 54, who are 2.4 times more likely to report worse outcomes overall, or worse health overall, 2.5 times more likely to have extreme psychological stress, and 2.6 times more likely to experience severe levels of pain. Now, it is currently also responsible for the loss of 10 to 13.5 years of healthy life, which is represented as a DALY. And that means that back pain is currently cutting health short by over a decade in these people. Not only is it costing us our health, it's costing us our wealth, because $3.4 billion was spent on back pain care in the healthcare system just last year. 2.1 billion was spent on hospitals, 724 million was spent on primary care, of 90% of this was GPs and pain medications, and 566 million was spent on referred services, 85% of which was on scans or images, MRIs, X-rays, CTs, all that sort of stuff. And there were also roughly 264 million days of work that are lost every single year due to back pain. So it's costing us financially individually. It's also costing us our relationships, because if you ask anybody who's experienced chronic pain issues how it affects their mental state, which affects their interactions with friends, partners, families, or co-workers, you're gonna hear that it's affecting their relationships. They got poor sleep, crappy mood, high levels of stress, greater mental health risk. There's social isolation. They're no longer participating in the hobbies or the sports. They're constantly missing out. There's a lack of understanding from their friends, families, partners, co-workers. They truly don't understand the impact that back pain is having on them. There's the obvious impact of physical intimacy and physical activity issues. And there's just the generalized fear and anxiety around the uncertainty of back pain. You have no idea how you are going to wake up each and every morning. Now let's talk about the 6-step process to beating low back pain. So this was a 66-page document that your GP, allied health professional, etc. should be aware of. And it's the general consensus of the best way to manage low back pain episodes. Now, why is this actually important to anyone? And it is because that it's been shown that people getting the wrong kind of care early on, that actually increases their chance that it's going to become a stubborn, ongoing issue down the road. So it's important to get this right at the start. So I have broken down the guideline into 6 distinct phases. Step 1, assessment. This involves having an appointment with a health pro, where they're going to be asking you a series of questions and putting you through a variety of physical assessments. Believe it or not, but most cases of back pain can be diagnosed just during the history taking or the asking of the questions. And the physical assessments such as reflexes, neurological exams, movement screening, the strength tests, that just help confirm what we expect to see. So if we know that less than 1% of cases are medically serious and less than 5% of cases actually impact the nerves, so think true sciatica symptoms, then the most important part of step 1 is to rule out the serious stuff. And if there's any suspicion, you will get referred for imaging. And we're going to talk more about this later. Step 2, reassurance. Your spine is very resilient. Your back cannot and does not go in and out of alignment when you do simple things like just sleeping wrong. Okay, there are lots of different factors that can influence your back pain. Things like your overall health, sleep, stress levels, nutrition, exercise levels, general mood, etc. But if it were that simple for your spine to just go out of alignment, and you believe that your chiro, osteo, physio, whoever is putting it back into place, just imagine the sort of damage that would be done to AFL or AFLW players each and every single game. Some of the reasons, or the biggest reasons that we think that back pain episodes turn into ongoing chronic and debilitating problems are because of the fear, activity avoidance, and unhelpful pain beliefs. Now, it's important to understand that all pain is real and it's not made up and it's not inside your head, but it's the job of the health pro to make all of this make sense, to answer any of your questions, and to give you the reassurance that you need that nothing sinister is happening. Despite it being painful as hell right now, that's normal, that's okay. But it's to give you the confidence that you need to let you know that you're going to be okay. And to boost this fact a little bit, 80% or 86% of all back pain cases will be completely resolved in 3 weeks. So just remember that the odds are in your favor. We've had assessment, we've had reassurance. Step 3, get moving. The faster you can get back to normal activities, the faster you'll recover. And I know that sounds like that's a little bit, I'm talking in reverse there, but the mental advantage of being able to continue on with life as normal as possible, that is the superpower of recovery. And yes, it might look a little bit different. You might need to temporarily stop some activities, modify some things, do slightly less, have more rests and breaks. But the overwhelming fact is that the longer that you spend in bed rest, the longer your recovery typically takes. Based on your original physical assessment, your health pro will be able to help you get started in a safe and manageable way. And if you're looking, just fun fact, if you're looking for the cheapest, most accessible, and often the most beneficial way to reduce back pain, regular short bouts of walking can be a really great option. And it's important to keep up physical activity even after your back pain has gone away, because that is the crucial step in preventing future episodes, not to mention all the other obvious health benefits that regular exercise has. If you're not a great exerciser, it can be a really good idea to work with a clinician or a coach who has a good understanding of back pain so they can help prod you along in the process. Assessment, reassurance, get moving. 4, self-management. I talk about this point often, but one of the things that we lose when we get injured is a sense of control over our own lives. And this is incredibly disempowering and can actually feel quite depressing. And that's why a good health pro helps you take back control of what you can. Things you can do for yourself that can influence your pain levels are more likely to help than passive treatments that are done to you. For example, physical activity, social connection, healthy sleep habits, and using heat packs make you feel more in control and therefore give you a greater sense of power than continuing with passive things like painkillers, massage, and just bed rests. And this doesn't mean that you don't employ some of these passive options. They can be a great way to get started and make you feel comfortable. However, they open the window to recovery. They are not the recovery process itself. The sooner that you can get involved with your healing and the recovery process, the faster and more successful your recovery will be. You are the superpower. Step 5, pain relief. If it's recommended, typically the lowest possible effective dose of anti-inflammatories, things like ibuprofen, Voltaren, Celebrex for a bit more advanced one, for the shortest amount of time is the first port of call. And the evidence shows that stronger options like anticonvulsants like gabapentin or antidepressants like benzos have limited effectiveness in reducing back pain, and they have significant risks attached to them. Also, opioid analgesics like codeine, morphine, they also have limited short-term effectiveness, and they also have a really high risk of dependence, and they've actually been shown to prolong recovery. I'm not saying that medication should never be used, by the way, okay? I always say that they exist for a reason. However, they should be reserved and used sparingly for acute and severe cases, and they are most likely going to be showing up in the emergency department, not in the clinic. And it's also important to remember that painkillers and pain medications, they exist to enable physical activity, not to eliminate pain. They are the gateway drug to the real good stuff, which is exercise and physical activity and movement. And this seems like a good idea or a good time to also highlight the benefits of other treatment options that you're familiar with, things like massage, cupping, needling, manipulations, cracking, etc. They can be very useful tools to enable physical activity, but any effect that they have on pain is typically very short term. They are not designed to eliminate pain. They are also designed to allow activity. Now the final step, step 6, monitor and review. Another quick reminder that the odds are in your favor. 50% of back pain cases are going to recover within 5 days, 70% within a week, 86% recover within 3 weeks. Back pain will typically get better on its own, even if you do no kind of intervention or treatment whatsoever. But it's important to have an ongoing line of communication with your coach or clinician so that you can keep them notified if something gets worse, new symptoms show up, or you need to keep progressing your activity level so you can keep getting better and better and better. It's a consistent cycle of helping you feel more capable, confident, and in control of your body whilst continuing to monitor if any signs of serious medical issues start to develop. Now, where are we going wrong at the moment with back pain? Because if we just heard what the global consensus of how to treat back pain is, I want you to go back to the start of the video and see how many people are being affected by back pain and where we are spending our money right now. Because chances are, if you've ever experienced back pain, what are you usually told? Rest, ice, painkillers, get a scan, go see a surgeon. And we are spending most of our money on GPs, pain medications, and scan referrals. Now, do you actually need a scan? We spend over $500 million on scans every single year, despite it only being recommended in 1 to 5% of the cases. Now, this means that 95% of cases should not be referred for imaging, whether it's X-ray, MRI, CT, etc. And you should absolutely not be getting routine scans from your local health practitioner for things like alignment checks. Now, to be pretty blunt, they aren't very good at telling us what's wrong. They are only useful in the 1 to 5% of cases to rule out something serious. And again, most health professionals can rule out these serious conditions simply by asking you some questions and doing a really simple physical exam. Now, in the article, you'll see a graph talking about why scans shouldn't be done. And it shows some data in there. And it's a graph that shows the results from people who get scans who have absolutely zero pain. And in there, at age 20, 37% of people, again without pain, will have degeneration. By age 50, this jumps up to 80% of people will show degeneration, and more than half of them will have disc bulges. Again, zero pain, zero symptoms. And if this many people have scan results that sound scary and have absolutely no pain, then what good are they to us? It's been shown that people who get unnecessary scans often have worse outcomes, and we can probably see why at this point. Because being told that you have a disc bulge or spinal degeneration can have an incredibly negative and harmful effect on people. And it can make you feel fragile and feel broken, and it often scares you away from the very thing that will help you recover, which is getting back to physical activity. Remember, 80% of people by age 50 would have what is often called degenerative disc disease. Imagine if we started calling other common age-related findings like this. Every wrinkle, we've got degenerative skin disease. Every grey hair, degenerative hair disease. Now, we're going to give you 3 action steps to take right now. If you're experiencing back pain, here are our 3 steps that we want you to take right now to get on top of it and stop letting it control your life. Step 1, get it assessed by a qualified health professional. make sure the 1 to 5% of medically serious conditions are ruled out, because this will immediately give you peace of mind and immediately reduce the amount of stress, fear, and worry. Number 2, find ways to be more active. It doesn't matter what kind of movement. It can be anything that reduces the amount of time that you are staying still. And it can be frustrating to not be able to do your usual routines, but whatever you can do, you should. Regular short bursts of 5 to 10 minutes can actually be more beneficial than longer sessions. Don't worry if it's just small little chunks. That is still great for you. And it's easy to focus on all the things that you can't do or are causing you pain right now. But make a big list of all the things that you can do that involve moving your body that doesn't make your pain significantly worse. Some mild discomfort is expected, but don't let it get more than a 4 or 5 out of 10 while you're exercising. Anything over a 5 out of 10 probably means that you're just not quite ready for it yet. Now, number 3, don't stop there. One of the most powerful ways you can protect yourself against future bouts of back pain is to continue to improve your overall health. And it doesn't take much. If you can just dedicate 20 minutes a day to boosting your health, this can make a huge change. Now, if you need help with back pain, hopefully this has given you a bit of a framework to get yourself started. But if you'd rather us go through this process with you, we suggest booking a quick call with one of our health pros with a special interest in back pain, and we will take it from there.